I'm Abe Abdul. I'm the president of the Massachusetts Dental Society. We have a very small group. I don't do PowerPoints. I feel like it's unnecessary. Whatever you need to learn, whatever you want to hear, I can give it to you. There's no point staring at the screen at the same time, so forgive me, no PowerPoint. I'm going to speak very frankly. You know, when we have small groups like this, especially at Harvard, it's easy to just talk to you folks one-on-one, explain to you how the real world works, versus give you some kind of presentation that's so esoteric that nobody understands what in God's name is going on. So give you a little bit of background of who I am, where I come from, and then we can get into the nitty-gritty as to how we want to get things done. Here, at least back when I was here, we were doers. We wanted to get things done, and we get things done. We have the strong background in academics, but more importantly, we get stuff done. We don't just talk about it. So, my undergraduate major, I went to Tufts. I'm originally from Hong Kong. I speak Chinese. I live in Pakistan. I lived in China, and I lived in Vancouver, British Columbia. So I'm sort of from everywhere. I came here, did my undergrad in chemical engineering, bio, and psych at Tufts. I'm a Boston person. And then when I finished, I did a master's in physics. I didn't finish, unfortunately. Tufts picked me up before I finished my degree. I did my dental school degree at Tufts, and then when I was finished, I was lost. I didn't know what I wanted to do. I had, all the specialties, like which one should I pick? I was going to do perio. They talked to Dr. Tarnow at NYU. I don't know if you guys know Tarnow. He's famous periodontics. And he's like, why do you want to be a periodontics? And I'm like, because I want to place implants. He's like, you don't have to be a periodontics to place implants. I'm like, really? He's like, yeah. I'm like, well, it was really nice talking to you. I'll see you some other day. My advisors always thought I should do something else. So anyhow, I was lost. I didn't know what I should do. So I came to Harvard. I did our GPR, the break. Medicine is very important. We're not just dentists. We are the dentists. We are oral health physicians. I think that's what they try to convince you guys that's what you are, but you really are. I had a very, very strong medicine background at Tufts. So when I came here, I did my residency. I was very, very comfortable. Treating bone marrow transplant patients. Whole nine yards. It was good. And then after that, started my own practice, picked up an MBA on the way, and then worked my way up in policy at the Massachusetts Dental Society. I've been with the Dental Society since I graduated. I was a grassroots advocate, meaning I was one of those guys that created a lunch for legislators, so they would come in and meet with us and discuss policy. So we've been around for about 160 years. We've been around for 160 years, and as far as I remember, this is the first time that we have recently passed 2 laws. First time in the history of dentists. If you look all around the country, you're going to find that it's very infrequent that dentists write laws, dentists create regulation. It's very infrequent. And one of the issues of that is everything you do is related to the rules and regulations, to the laws. Like look at student loans. The interest issues, right? Should you be able to write off interest? 100%, right? If I buy a building, I can write off interest. A mortgage, I can. Why can't student loan interest be? Right? And should student loan interest rates be controlled better? Should there be a different kind of tier of rating? There shouldn't. It doesn't exist. It's a policy, right? If you're a dentist in Massachusetts, should you be able to practice in California? I mean, does your dental degree deteriorate every time you cross the state line? In my perspective, I think it's completely crazy. Right? If you're a dentist, and I'm going to get to some areas that are like controversial, right? If you're a dentist who trained in Canada, or Brazil, or China, should you really have to do 2 more years of dental school to be able to practice here in the United States? You can have your own opinions, but these these are the things that affect us daily. Insurance companies, right? Prior to MLR, we'll talk about MLR, okay? They took in the money, and they get to spend whatever the hell they wanted to spend on direct patient care. Is that crazy? Whatever they want. There's there are ratios, meaning how much they spend on patient care versus they've taken in the low 20s and 30s across the country. That means they take in $100, they pay out $20, $30. So the administrative fee is $70 bucks. The rules and the laws affect us so much, yet we as a profession, the last 100 or so years, haven't really spent enough time in trying to address these rules. You just heard Utah. Dan, I'm right. Utah canceled fluoridation, right?
Say what?
Can you believe this? Today I was with a patient, and she was in my chair, and she said, "Abe, I see all these fluoride posters in your office. Fluoride's not good. I heard it's not good." And I'm like, all right, here we go. Let me explain this one time. So, policies affect the way the universe works, right? So my question is to you, what do you want to hear? What do you want to thank you. What do you want to hear today? It's important.
I want to hear about why ethics matters for us.
And I sort of told you this, like why it matters, right? Because everything you do involves, it doesn't matter which dental school you go to, policy affects you. So I'll give you an example. When you graduate, if you decide to work in practice, that takes insurance. You have to wait about a month or two to go through a process called credentialing. It means the insurance companies have to see if you're qualified enough to be a dentist. Is that crazy? You go to Harvard, right? Finish, you see patients. You come out, the insurance company makes you fill in all these paperwork. It makes you wait a month or two to credential. So who's paying you for the 2 months? Nobody. It's an issue. What do you want?
I'm curious, this is less about advocacy specifically, but I'm curious, like, how did you get started specifically with the MDS, and then what does the inner workings of the MDS actually look like?
Okay. So, that's a great question. So, graduated, when I was at Tufts, I was next to Chinatown. That was my neighborhood. I speak Chinese. And in our class of 100 and something, there were only 2 people that spoke Chinese. Me and my classmate Cootie. And what we realized was that Chinatown community didn't really fully utilize Tufts. We were their neighbors, but they didn't come over. So what I did was I talked to the administrators at that time saying, you know what, we need to create a program to have outreach to get them to come and see us. Because we need the patients to fulfill our requirements, right? And number 2, public health, right? I mean, we want to do something. So I started off going to, on my own, going to the schools to teach little kids. There's no program, it's not sponsored by the schools. I go to the schools and I teach little kids how to brush their teeth. I just did it after class, right? And what happened was that transformed into something called the Albert Schweitzer project. And I realized at that time that an individual person could create change. So that program ended up working out for a long time at Tufts, where we did screenings. So my mind changed at that time. That is, individuals, even without institutional support, can create change. It's possible, it did. Right? So I started off at, I started my practice, and 1 year or so into my practice, and I take mass health, right? Medicaid. You know what happened? They cut Medicaid. Medicaid was cut. 80% of my practice overnight was going to get wiped. So I did what I did at Tufts. I was going to be an advocate, right? So I put on a suit. I was poor, bought a cheap suit, and I went to the State House. And I said, I want to meet my senator. His name is Michael Morrissey. He's now the DA of Norfolk County. And I said, Michael, I need you to protect mass health. He's like, what do you mean? He said, I need you to vote so that we do not cut mass health. So So Michael Morrissey took me aback. We went to the voting floor. He voted and we still lost. He goes, kiddo, you voted for Mass Health, you still lost it. Now it's still time. For my own selfish reasons, I had to protect my practice, right? Because I met a couple of this gentleman, Dr. Art Eddy. Do you know Dr. Eddy, Dan?
I don't know if I've met him yet.
At that time, he came to me and says, hey, you can't be advocating and doing these kinds of things on your own. You have to be part of the Massachusetts Dentists. So he created an artificial board position in his committee. It's a committee position. And I started off being an advocate. So 3 years ago, Mo, you're going to hear from Mo at your next session. Mo came and gave me a call. And he said, Abe, you're going to be president of the Dental Society. You must advocate for MLR. Medical loss ratio. So anyways, long story short, me and Mo, we worked together. We built a grassroots team to advocate for MLR. We brought our Dental Society in, we brought the ADA in. We raised $8 million in total. And we had a huge campaign in Massachusetts. And we won. A ballot issue. 73% of the people supported there to be a medical law, meaning forcing insurance companies to have to spend 83% or whatever they call it, collective indemnification. But it was a lot of hard work. At the beginning, when the two of us approached people, even the ADA, to say we want to do MLR, they thought we were crazy. What do you think people? We're going to fight the insurance company, right? What do you think people are afraid of? What do you think they're concerned?
I think the ADA is afraid that people aren't going to give them more money.
Okay, but when you're fighting the insurance companies, what do you think are the barriers to fighting?
They probably have more money
Probably.
to lobby and spend.
They definitely have. We were concerned that they would outgun us. 8 million is a drop in the bucket. Remember, we're not fighting one insurance company. We're fighting the whole entire industry of insurance companies. Right? We're telling them that they need to get a haircut on what they're collecting. That's what we're essentially saying. Right? So a lot of people were afraid that we wouldn't win because we're fighting the insurance companies. A lot of people were afraid they might get in trouble fighting the insurance companies. Right? They might be vindictive. Correct? And we're practicing, and we're both practicing dentists. So we had those concerns too. It's not just everybody else. And a lot of dentists are like, oh, why are you guys doing this? Don't you have something better to do? Do you really want to do this? So it was really hard. But through local advocacy and talking to small groups like you folks, we convinced people to hop on board with us. And we were doubtful, two of us. We didn't know we'd have like every other day we'd be on the phone with each other for an hour or two. And then there'd be disappointments where we would fail. And we would comfort one another, saying, you know, it's okay. So-and-so wouldn't even answer our phone call. Or so-and-so promised to meet us, and on the day of meeting us, they decided not to show up. Right? So-and-so wouldn't support us. Right? I mean, many of you may become entrepreneurs someday. It's the entrepreneur lifestyle. Disappointment. Being able to manage disappointment. And we managed a lot of disappointment. And I remember when our MDS the PAC decided, or they were the first group that decided to support us. And they decided to give us $100,000. Right? We were so happy. You know, that was one of the greatest moments. And then when individual dentists decided to give us money, that was amazing. And then when the MDS decided to hop on, we were so happy. And then when the ADA decided to hop on, there's a lot of background phone calls, right? Trying to get things done. I was in government affairs at that time, and trying to get a big. You guys at Harvard, we know this, right? Even at Harvard, if we have a new idea, a great idea, and we want to get it through administration to have them support it. I mean, it's a circus act. We all know this, right? And that's how it is. That's the world. So the ADA finally supported us. We were grateful. Right? So that was MLR, which MLR, in my opinion, what we did here in Massachusetts, Mo and I, we believe it is the most significant and influential piece of legislation in dentistry, not only for Massachusetts, but for nationwide. Okay? We have forced insurance companies, we've created a standard that they should spend 82% on direct patient healthcare. And we just heard another state has adopted it. Which state is it?
North Dakota.
North Dakota. And we know a lot of our surrounding states are. Another two pieces of legislation that may be interesting is about 3 years ago I wrote one where it's called dental diversion. So when we dentists have a mental health breakdown or an opioid issue, traditionally, you know what the board would do? Suspend it or remove it for good. So tell me, if they remove a dentist's license, who does that help? Well, the auspices here is public health, protecting public health. That's why they do it. So they're not bad people, let's just take licenses away. But for the sake of efficiency, right? How much does it cost to train a dentist? A lot. Pick a number. 500, 600, 700, yeah? How long does it take to train a dentist? Well, including undergrad, yeah? So minimal 8 years. The trend now is a year of masters or whatever. So it's 9 years. And then the trend is some specialty. Most of you guys are going to be specialists, right? So you took like 12, 13 years. Why do people develop mental health issues or opioid issues? Is it because they're bad people? Why? Would you agree it's a pathology? Like cancer? Like cardiovascular disease? Would you agree it's similar? Yes? There's some commonalities. So if somebody has cardiovascular disease, we take their dental license away. So they had these diversion programs for physicians, they had them for nurses, they had them for pharmacists, they had them in many, many states. But we didn't have them in Massachusetts. So I wrote the law with Representative Chen, and that's one of the laws that we passed this year. Then another one is, how many of you want to graduate dental school and clean teeth all day? Perio, there you go. Our gum gardener. He's going to take care of it. He's going to clean teeth all day. No, but seriously, how many of you really want to do that? Probably not, right? But if you don't have a hygienist, what happens? You have to do it. You have to do it. You have to do it. Or, so this is a zero-sum game. You know, in many things that I talk about, negotiations and work, things are not zero-sum. We want to make pie bigger, we want to work together, right? But this hygiene issue is really a zero-sum game. There's only a fixed number of hygienists. We lost a whole bunch of them during COVID. I'll tell you some of the reasons why they left, right? They left because of health reasons. They left because of childcare, lack of childcare. They left because of retirement. They left because work-life balance. They left because the stresses of being a hygienist is just so high. Okay. So if you have few hygienists and you've got many practices, supply and demand. I know this is not HBS, but okay. What do you think happens to the cost of having hygienists? It goes up, right? But where's the ceiling? Well, it depends how desperate you get, right? Well, how much does insurance companies pay for you to have your patient's teeth cleaned? Less, actually. So MassHealth pays about 50. Loanne, how much?
53.
50. Loanne's my wife, she knows. So $53, right? $53. We pay our hygienists, this is between us, $70 an hour, plus bonuses. So bonus, you're at like another 10, 15. So you're paying at $85 an hour. So how does this work? So because I don't want to clean teeth, I will have to lose money with the hygienist, right? Okay. So we're all innovators here. We're smart. Okay. The question now is, how do we get more hygienists into the system? Tell me, what do I do? How do I get more hygienists?
Well, I'm not gonna do it because
Okay, you're not gonna have to.
because I could be doing something that worth more money. So I'll be losing money if I do it. So I could get different students to do it. There's a way to do that.
Sure.
But I don't think it's utilized very often.
So second year dental students in Massachusetts can get a hygienist, just so you guys know. Alright? But I don't know how many second years you are here today. Do we have any second years? Wow, that's a lot of second years. I guess the third and fourth years are like,
I like that one.
You like that one?
I'm a hygienist.
There you go, dude. You got a job.
Yeah.
All right, so the question is, a lot of you are in class, and it's busy, right? I mean, is it really practical for you to go? For some of you, you're desperate, you know? I'll tell you one more thing. I was informed that there is a food insecurity issues in our food schools. Okay? And I didn't know what the hell that meant, I'll be honest with you. And because I didn't want to understand what it meant. So after I heard that, I went back to MDS to my board, and I said, we need to create a food pantry program. So I don't know if you guys heard, but your lockers, they used to fund it like $100 a semester or something. Now you guys are gonna get $600 every month to fund those lockers, plus Delta Dental, you know.
Well,
I
they
mean,
don't have it yet.
It's coming.
No, they don't have it for second years and first years.
You don't have the
But by the
lockers.
time, when you start seeing patients, you get a locker.
We have the lockers.
But you already
Yeah.
have one. Oh,
We
you
know
have
that
one.
you guys will be funding.
We used to only have one, then it grew. Okay.
So I heard that, and I'm like, there's freaking no way this is gonna happen. So I went back to my board and I'm like, look, we need to have a food pantry program. And my board voted with me unanimously, okay, to do this. So, you know, you guys are gonna get, with Delta's funding, you're gonna get $1,200 a month for your lockers. Look, I know I'm not solving, you know, world hunger here, okay, but at least I'm doing something, right? So that's probably more meaningful to you guys at this point than all my legislation that I'm writing, right? But look, I'll tell you, I was informed by one dental school, I won't tell you who, it's not you guys, that their students, 2 students last week, was asking for help from the schools because they seriously can't afford food. These are dental schools. And one dental school told me that if there was a food pantry, 80% of them would use it. 80%. This is insanity, guys. This is crazy. So anyhow, you know, the reason I brought that up is to point out that you know, second year dental, some of you are like, you know, hey, I'm too busy, I can't work, right? But then there are students out there who can't afford food. They're working, guys. You don't want to work, good for you, don't work. But don't go mess up somebody else's part, right? Because I've heard, you know, the people who are, I'll tell you about the legislation about the hygienists, right? The hygienists are coming to tell me, it's wrong that you're allowing dental students to work after their second. I'm like, who the hell are you to tell me? These guys are hungry. They have no money. I mean, why don't you write them a check, right? Look, it's survival. If you gotta work, you gotta work. They cannot stop us, right? If we have a food issue here in these schools, and somebody can work and make $60, $70 an hour, and you're stopping them, they're like, well, they don't have enough experience. I'm like, well, they're gonna get it, right? Because if you stop them, they're never gonna get the experience. How are they gonna get the experience? And plus, I think the sooner you get into clinic, even if you're cleaning teeth, the better of a doctor you become. In fact, you know when you become a really good doctor? When you get sick, and you learn what's going on in the system, and you learn what it's like to be a patient. That is when you become a really good doctor. I promise you. And when you learn about like you know how the healthcare system is not that great, when you or your loved ones get sick. When my mom got sick, I trained at the Brigham. I mean, that's my hospital. I realized the problems that I never saw before. I walk in a white coat, like all men telling people how the world should work. I saw how it works. So anyhow, how can we inject? Sorry, we're talking about something else. How can we inject a whole new pool of hygienists into the workforce in the shortest period of time? What do I do?
Pay everybody.
You can't, you got it's zero sum game. So I can pay more money still.
Lessen the requirements to become.
Lessen the requirements, I like that. Like how? Okay, this is great. Lessen what requirements?
Like, shorten hygiene school.
That's a good idea. What else?
Make hygiene school cheaper.
That's a good budget. What else?
I'll run it out.
You're running out? Come on, man. What else can I do? More hygiene schools. Okay. Are all hygiene schools at capacity? Yeah?
I would say no.
No.
I mean, the
So
program's
even if you
not.
have them, they're not. So that's a good idea.
Make them be able to be trained at their dental.
You mean the students?
Yeah.
Okay, fine. What else? Fine. I see your hand up.
Foreign trained dentist.
Oh my God, you're a genius. You stole my idea. So, so I thought, because I'm foreign, right? I hope ICE doesn't pick me up. Because I'm foreign, I thought about this. A doctor in a foreign country with good training should be able to clean teeth, don't you think? Yeah, possibly. How about a doctor who's been practicing for like 5 years? Think they can clean teeth? So I wrote that law with representation. And I said, you know what? There's the solution. Bang. Just 4 little things. For some reason, whenever you have a good idea, there's always a ton of people that would just water it down for you. They'll tell you it's not going to work. So this is what I heard. The Hygiene Association got an Indian dentist to put up a video that says in India, in dental school, they never really cleaned us, never really taught us how to clean. There's some who says, you know what, this is dangerous. I mean, can you imagine foreign trained dentists? And some would even say something crazy. Dentists in general don't know how to clean. I really said this. This is real. But the political climate was just in time. So we're talking about just in time, right? The political climate was just in time. Post-COVID, there was a labor shortage, right? The whole country is suffering from a labor shortage. The legislators are seeing this in every industry. So we go to a hearing on the legislation in Rome. And right after the hearing, a senator and a House representative goes, hey, can I talk to you for a second? I'm like, yeah. Because my hygiene appointment keeps getting canceled. Is that why? And I lied. I said, hell yeah. That's why, you got it. No way, really, tell me about it. I wanted to flame the fire, right? Tell me more about this. And they're like, yeah, man, you know, it just keeps getting canceled. It's been canceled for 6 months. And then the senator goes, Abe, is that why every time I go into my dental office, it's a different hygienist? I'm like, yeah. That's exactly the reason why. They're like, yeah, we need to support this. I'm like, you're right. You need to support it for your hygiene appointments, right? So, long story short, both our legislation, the dental diversion and the hygiene bill, you know, the House, so there's a House, there's a Senate, and there's the government, right? The House approves it, and then it goes to the Senate. The Senate reviews it, and then guess what happens? We have a legislator that doesn't like us. Well, we took the time to explain to her why this is important. And you know what? Emails and texts are so insensitive. People don't really know who you are. They have a perception. Trust me. When you say Harvard Dental School, people already started to think things. 100%. Dentist, right away. People are. What do you think? What do you think people think when you say dentist? What do they think?
The last time they saw their dentist, maybe in pain.
Or pain.
Maybe they're anxious, or maybe they don't know why it costs so much.
money, right? The cost. They already assume this, right? So legislators are, you know what they are? Lay people. So they always think like, you know, we're rich dentists, we're in for ourselves. There's some kind of gimmick.
Actually, that's true. Because
That's true?
On my
No
flight
way.
back, on my way back, this engineer sat next to me from North Carolina. He was like, "I'm a car guy. All the dentists like Porsche 911s." And I was like,
True.
"Sure." So they do think we like expensive things.
So they think, so the legislators think that. So you're already at a disadvantage as soon as you walk in the room, right? You're just greedy. There's something you want. So anyhow, we convinced this legislator by meeting her in person, telling her our story, saying, look, if there are no hygienists, new patients are not able to get the care that they need. Because the hygienists, we need them. They are they're critical parts of our team. And they're sort of they're not our gatekeepers, they're our gate welcomers. That's what I call them, right? So if we don't have them, nobody's there to welcome the new patients, right? Anyhow, she sort of, I don't know if she supported us or she didn't, but my feeling is that she sort of just let it slide. Anyways, we were in communication with many legislators. We'll talk about how to pass a law later, right? She let it slide, and you know the Senate supported us, sort of let the law out, and and then it came back to the House. Everybody, this had to come out. So the night before the deadline for it to come out, you can ask Dan. I'm on the phone with him. I'm on the phone with every legislator. I'm calling like crazy. I'm promising all sorts of things. You know, I'm saying, you would do this. You can have my first child, all right? I'll give it to you. So it came out of the House of the Senate, and the governor had to sign it. She signs it at the last minute. I mean, Dan may or may not know I did this, but the Hispanic Dental Association, I had them rain hell phone calls. Governor's office, at the House and the Senate. You know why that community cares? Because they have a lot of foreign trained dentists. Look, being an immigrant is tough. I'm an immigrant. Okay? You gotta come, and I'll tell you, I'm lucky I'm educated immigrant. But you could be an educated immigrant, and if you come here and you don't have the opportunities, you're still working at Starbucks, driving Ubers, right? And if you want to come to the IS program at Harvard or Tufts or BU, you're still talking about a big chunk of people. And if you have kids, look, you guys are doing, most of you doing dental school first time, right? First time, yes? Yeah? Can you imagine having to do it second time? Yeah, but it speaks to the desperation, the ambition, the want to be a doctor versus a dish worker, right? Look, once you become a dentist, a doctor, I promise you it's going to be so hard for you to go back and serve tables or drive Ubers. It's going to be so hard. Right? I can't even imagine. These folks are doing it. Is it not the American dream, which I don't know what it is anymore, but I assume it's still the same deal, okay? Is it not the American dream to come here and do better? So this law will do exactly that. It will give them an opportunity. These doctors, they're doctors. I don't care where you graduate from. You will never get us to not call them doctors, right? It'll allow these doctors to have an opportunity to basically fund their education and fund their families. And guess what? It may also help solve our hygiene problem, right? So last year, I was informed that in total, all three schools, they received about 5,000 international applications, right? There's some redundancies also. And only about 200-ish got accepted. I think here at Harvard we take like 2 or 3. You know, we have 2 or 3. It's like a secret program. It's not published or something. I don't understand why. But I think we take 2 or 3. The other schools take about 200. Right? So if there's 5,000, let's say 50% is redundancy, right? So we've got 2,500. Okay? And then let's take out the 200 from that. That still leaves us with like 2,000-ish. Yeah? And then there's the people who didn't even apply because they're so broke they can't apply. They just got a new baby, or they have 5 kids, they can't apply. Imagine if 50% of those folks get a hygiene license. That's like 1,000 hygienists. In Massachusetts, I think we have about 5,000 hygienists. I don't know how often they practice. I don't know anything. But that's 1,000. Does that sort of maybe help the problem? So that's what I have to share with you on the MLR, medical loss ratio, and on the 2 laws that we passed. Now you learn about the food pantry. I'm going to stop and answer some questions. Then I'm going to tell you how a law is really passed. How do you really do it?
I might have missed it, but could you describe what the diversion law is again?
Dental diversion.
Yeah.
Of course. Dental diversion is a fancy name. What it really means is this. So, say I develop an opioid issue, right? And there's a board complaint against me. Traditionally, they take my license. But what happens now is it's not a choice. The board has to send me to a diversion. And I have to give me that opportunity, and I have to accept. If I accept, and I go through this diversion program, and I go through recovery, once, and I volunteer to go through this program, this information that I volunteered to go in cannot be subpoenaed, meaning it's confidential. And after 3 years, and nothing happens, and I'm good, this record gets torn, thrown away, disappears. The dentist gets his life back. Okay. The community, I was talking about community, the community gets their dentist back. Right? And this $500,000, $600,000, $700,000 doesn't disappear. And I say, I talk about opioid. What is the mental health issue? Someone has a complete breakdown, right? Same thing applies. You go through rehabilitation, you get rehabilitation, you get arrested. Does that explain? Yeah. So that's called dental diversion. It's really like a help program, a recovery program. I wish that we just called it a recovery program. And by the way, this does not only apply to dentists, it applies to hygienists as well. I always say they are part of our team, just like nurses, physician assistants, physicians. It's one ecosystem. So we protect them. Any other questions? Please.
What's it like to talk to legislators who really, who are making decisions on things that have wide impacts, but they really don't know much about dentistry? And you know that this law, if it came into effect, it's going to have a tremendous impact. The legislators just have not mind it, just simply because they maybe don't know enough.
So whose fault is it that they don't?
It's ours.
Takes responsibility. I like it. It's ours. It's our responsibility. Legislators on the national level or on the state level, they're inundated every single day by special interests. Okay? And special interest is not a bad word, right? Because we're a special interest. I'm a special interest, right? So I'll take Representative Chan, who's a dear friend. A group that lobbies him a lot is the movie industry. Yeah. So they're always there. I don't know what they talk about. I don't even understand, but they lobby. Right? The alcohol packaging companies, they lobby. Tobacco companies, they lobby. Pharmaceutical companies, they lobby. So if you're a legislator, you're listening to every single all sorts of weird stuff. Like if you're assigned to a particular committee, you probably hear more from that particular, the interests that committee sort of addresses. But if you're, but you also hear from people that have absolutely nothing to do with the committee, especially if you're in leadership, right? So imagine you're in the office hearing about the movie industry, hearing about declawing of cats, hearing about shortage of hygienists, hearing about the MBTA not working too well. You're hearing about all these things, right? And then you've got to write a bill for every single one of these things, right? And then you write the bill, so what? The vast majority of those never see the light of day. It just dies. They get sent to study. And it's dead. Our village usually go to study. And when it's done. So what do you have to do to let them better understand your ability? What's important to you? What did you do in your Harvard application to make sure that that application was the best application in the world so you could get it? What did you do? What did you do?
You gotta make yourself stand out.
And how did you do that?
I had a circuitous route to dentistry.
Okay.
Yeah.
Tell us about it.
I started out as an accounting major, then I had a few different jobs and experiences that led me to dentistry.
So what did he do? What, I mean, in effect, what did he do? He told a story. Who said that? He told a story. I'm telling you stories all day. I'm a storyteller. Right? You gotta tell a story. But who's gonna tell? So is it better if 5 people come in and tell different stories, but the conclusion of the stories is the same story? Or is it better if they keep hearing Dr. Abe tell them stories? I'm sure they're tired of my stories, right? Because I keep telling stories. But what if you guys went and told the story? You know what? I'm gonna pen to be very honest. And when I come out, I don't want to be cleaning teeth because I think I can serve my patients better if I can do CTGs, GPRs, placing ones. But because I don't have a hygienist when I come out, I might have to clean teeth. What do you think, Sam? What do you think I should do? Oh, by the way, I spent already $500,000 on my education, and Penn's gonna take another $250 off me. What do you think I should do? There's a story. You know, when they told me stories, when I tell them stories, great. But when they tell me stories that's relevant to what I'm advocating for, I really want it.